I'm Tunde Peto, Professor of Clinical Ophthalmology at Queen's University Belfast, and also the clinical lead for diabetic eye screening in Northern Ireland. So once you're diagnosed with diabetes, diabetic eye screening programs will be notified by your GP, and we will have a look at your eye health within about 3 months of diagnosis. After that, we will be asking you to come back for regular eye screening. And it's very important because we are able to then catch any developing problems early enough to be able to provide good quality treatment. We recommend that people attend it every year or 2 yearly. Most people who come to diabetic eye screening will have a result of having either no diabetic retinopathy, which means that there are no diabetes-related changes in the back of the eye, or early diabetes-related changes in the back of the eye. These changes can be monitored either yearly, or if there is no diabetic retinopathy, 2 yearly, in order to make sure that we catch anything that might develop over the year or 2 years. So everyone who comes for diabetic eye screening, you will have images taken of the back of the eye using a camera. You need to put your chin on the rest, and there will be some white light, bright light coming into the eye as the images are taken. Some people will need to have drops put into the eyes. The drops will sting for about 10 to 30 seconds, so it's well worth counting in your head. And then they will take 10 to 15 minutes to work. Usually they work quicker in people with blue eyes than those with brown eyes, so you might have to wait a different time period. Once the drops worked, we will attempt to take images again. If the images are good quality, then they will be sent for grading, and the results of the image analysis will be sent to people within 3 weeks, usually, of the screening. If the images are not such a great quality, people might be asked to come back to what we call a slit lamp examination, which is a very similar examination to what you would have done at your optometrist when you go for your glasses test. Again, it's just put your chin on the rest, but someone will actually physically look at the back of the eye just to make sure that those areas that couldn't be photographed are seen in full. We also recommend that you don't drive home after screening if you needed to have your eyes dilated, or you might have to wait a few hours before you're safe to drive.